All right, let's take a look at this clinical PowerPoint presentation assignment. Whether you are an AMP1 or AMP2, the presentation topic will differ depending on what course you're in, but everything I'm about to say with the rubric and creating the assignment is the exact same. So when you access this assignment, make sure first look at the presentation topic. Note our directions here. You're going to be using your textbook, reputable websites, okay, absolutely no Wikipedia. So make sure you're looking at legitimate medical or academic websites to research your presentation topic. So what you'll want to do, we have directions here for you to click this link. I'll click that in just a moment. This right here is the grading rubric, the exact document that I will be using to grade your PowerPoint presentations. So please make sure you are familiar with this. You can see we have 1, 2, 3, 4, 5 criteria, and you can either earn 20, 17, 15, 13, or 0 points within each criterion. So I tell you exactly what you need to do in order to earn all 20 points. This is what your slides will look like if you only earn 17, 15, 13, so on and so forth. So please make sure that you have this handy when you are creating your assignment so that you know without a shadow of a doubt when you turn this in, you have done everything to make 20 points within each criterion to total a perfect 100. And I know you can do that as long as you pay attention. So let's go ahead and click this link. And when that opens, you'll see this PowerPoint presentation. So clinical presentation directions, you will want to download this so that you can open it up in your own PowerPoint program. So here I note you may use the following slides as a template. You need to have a minimum of 7 slides total, and that falls under the format, okay? So just make sure that you have at least 7 slides. Otherwise, there's no way you can get 20 out of 20 points for that criterion. I would say most students will have anywhere between 7 and 10 slides for this assignment. This is really important. Make sure you're doing your own work, that you are wording things in your own words. So please do not copy and paste from websites. I'll tell you why in just a moment. Make sure you're taking what you find from the websites and you rephrase it. If you're working on this assignment with a friend, make sure your words are different from each other. And again, I'll emphasize that in just a moment. Same thing with formatting. Make sure that you are doing your own formatting, slide design, etc. One thing I'll be looking for is that each presentation is unique. So that brings us to this point right here. Each PowerPoint assignment will be submitted through a plagiarism checker, and you'll get a score report. So if you are just copying and pasting from websites, or if you are typing out the same exact thing your friend is putting on his or her PowerPoint presentation, that will show up in this plagiarism report. So just please, please, please make sure you're doing your own work. Otherwise, you will be required to resubmit your assignment. Okay, and if you don't, then that may or may not mean that you may earn a 0 on this assignment. So just make sure you're doing your own work. Okay, here's that grading rubric again. It's formatted a little bit more nicely. So let me zoom in here a little bit. So just reminding you that your grade will be calculated based on how many points you earn in each category. So here, what I would do is I would print this slide out and have it off to the side when you're making your own PowerPoint. so that you can literally just go down the list and make sure that you meet everything for this 20-point column. These other point columns, if you end up making a grade in one of these columns, I tell you exactly why. It's because you were missing something, you didn't complete it, so on and so forth. So this grading rubric is your best friend, essentially. Okay, so as I mentioned in the other instructions, this is the format. So I basically put a little example PowerPoint for you. Of course, in the assignment you are turning into me, you of course would not have this slide or this slide. The first slide would be your title slide. So put whatever your title is here. Yeah, definitely have your name, the date, the course, whether you are 2401 or 2402, our section number, and your seat number. So for content, oh, and by the way, this does count as one of your 7 slides. So that's really nice. Okay, here, content. So here I've noted, please be sure to create enough content slides to meet the slide requirement. Remember, minimum of 7, anything less than 7, and there's just no way you can get a 20 out of 20 on that first criterion. At the top of each slide, please title the slide according to the categories listed in the rubric. So I said, for example, one slide should be titled symptoms, while another slide would be titled treatment. This one is titled content because I'm telling you this is what your content slide should be, what it should look like. So going back here, when I say each slide should be titled according to the categories listed in the rubric, again, what did I say about this? You want this out. So here, let me zoom in again. For example, you may have a slide titled definition. You might have another slide titled relevant anatomy. You might have another slide for symptoms and one for diagnosis, and one for cause, one for risk factors, and another one for treatment. Now, you are welcome to combine these two onto one slide. Again, just make sure you have at least 7 slides total. Okay, here, this is where your image goes, and the image also counts towards your total slide count, so that's really nice. I've noted that you just need to put an image here, okay? So please do not put any video clips in. That really affects the file size. It kind of makes it a little bit more difficult, and we're just trying to make this as short and sweet as possible. Please note that your image must relate to the clinical case, whatever that topic is. So it could be an image of whatever the relevant anatomy is. It could be some type of diagnostic image. So maybe you found, I don't know, a CT scan or an MRI or an X-ray, anything like that is related to your specific topic. That would be fine. Or maybe an image of a procedure or treatment option. So maybe it's an image of specific type of medication, or maybe it's like an image of an arthroscopic surgery, something like that. Again, get as creative as you want, and that image will go, and really the image slide can be placed anywhere in the presentation that makes the most sense to you. So whether it's at the very beginning or the end of the presentation, or it's embedded somewhere in between these, doesn't matter to me, just make it make sense for you. And then finally, as we scroll down, you will have to have a reference slide. So again, this is actually the title of the slide. So I want it to say references. I've noted here if you want to use our textbook, or if you've taken any information from our textbook, and by the way, that should be where you first start. You may be surprised as to how much information you can find just by going to our textbook. So if you use our textbook, obviously get rid of this bullet point here and you can simply just use what I've basically put that citation in there for you just to make it easier. And then if you have any other websites you've used, you can just copy and paste the link. It's okay. I'm not necessarily looking for APA format or anything. Just copy and paste those links. Again, one link per bullet point, and that does include a web link for your image as well. So basically, any website you used to help you complete this assignment, that is what you will put in your reference slide. So going down here, if you are confused and you're asking yourself, well, what does she mean by relevant anatomy? Let's go back to this grading rubric. So again, I've gone up here. I'm just going to minimize that. This was the first thing I showed you. And so format, what does format mean? Okay, I'm counting the amount of slides you have. Did you put the proper title on each slide? Do you have an image slide? Do you have the reference slide? Is your work original? Okay, so I'm told you just plain as day. That's what I'm looking for in regards to format. So for definition, relevant anatomy, again, have you defined what your presentation topic is? Relevant anatomy should consist of terms from your lab manual related to the specific topic. That is the whole point of this assignment, is that we are relating something in the clinical world to things we've looked at in lab. So I anticipate that no matter what your presentation topic is, I anticipate seeing terminology that we have looked at this semester. For symptoms and diagnosis, so just a little reminder here, a symptom is something that a patient experiences that creates concern for an issue. So this may be a mental ailment, this may be a physical ailment, but again, the key word is that the patient is experiencing something that basically causes them to think, hey, I think there's might be something going on with me. The diagnosis, in contrast, is the process by which a healthcare provider is going to, maybe use diagnostic imaging, blood tests, a physical exam, anything that they use, any process they use to try to get to the answer, that's what the diagnosis is, okay? And then as we go down to here, causes versus risk factors. So a cause is just that, meaning this illness was caused by X, Y, and Z. There is a direct pathological explanation for the nature of the illness. Okay? A risk factor, however, is something that predisposes someone to develop the illness. It doesn't mean that you will develop it. It just means because you fit this criterion, whether it's your age, okay, whether if you're male or female, whether you are a smoker or a non-smoker, you exercise, you don't exercise, you are overweight, you are underweight, whatever it is, a genetic predisposition. That's what a risk factor is. It basically says that you are at higher risk or higher potential to develop this illness because you fit these categories. And then finally, for treatment, of course, this is any kind of advice or therapeutic. Okay, so I want you guys to understand that treatment does not always equal medication. It does sometimes, but other times it's the treatment is maybe some physical therapy, or it's a dietary change, maybe it's a lifestyle change. But whatever is recommended by the healthcare professional to help the patient overcome this illness, that falls under the treatment. So as long as you guys follow and focus on this 20-point column as you go through this, This assignment should not be very difficult. It's not intended to be very difficult. If it is, just let me know. You're probably overthinking it, and I don't want any of y'all to be doing that. So there you have it. Let me know if you have any questions, but I think you guys are going to do a great job with this.